Welcome back to the Thyroid Stimulating Podcast. This podcast was created in partnership with the American Thyroid Association to discuss up to date diagnosis and management of a wide array of thyroid diseases. I'm your host, Dr. Kaniksha Desai, and in today's episode, we're focusing on the growing popularity and controversy surrounding thyroid supplements. This trend is especially noticeable at the start of the new year when many people commit to health related resolutions and turn to supplements as a quick fix for improving their energy, metabolism, or overall wellness. With an increasing number of patients turning to over the counter solutions to manage symptoms, healthcare providers are often left addressing the consequences of unregulated products, misinformation, and potential health risks. To help us navigate this complex topic, we're honored to welcome Dr. Victor Bernet. Dr. Bernet is a distinguished professor of medicine at the Mayo Clinic in Jacksonville, Florida, and a recognized expert in the field of thyroidology. He served as the chair of endocrinology at Mayo Clinic from 2012 to 2022 and currently is the program director of the Endocrinology, Diabetes, and Metabolism Fellowship there. Dr. Bernet has also served as the past president of the American Thyroid Association from 2020 to 2021 and is a retired colonel in the U.S. Army Medical Corps with over 21 years of active duty service. With numerous peer-reviewed publications, including an article examining the quality of thyroid supplements on the market, he brings a wealth of knowledge and experience to this important discussion. We'll break down the evidence surrounding thyroid supplements, discuss the safety concerns tied to these supplements, and explore strategies for guiding your patients towards safer and evidence-based approaches to improving thyroid health. If you've ever had a patient ask about thyroid supplements or seen the impact of self-prescribed treatments, this episode is for you. Together, we'll delve into the science and examine how healthcare providers can better support patients in making informed decisions about their thyroid health. So thank you, Dr. Burnett.
Kaniksha, thank you for having me. I'm glad to be here and talk about this topic.
So let's start with the basics. What are thyroid supplements that are on the market and why are they so popular despite the concerns about their safety?
I think in your opening, you kind of mentioned that patients are looking to solve problems with fatigue and weight gain and having just more energy and such. And so it's very commonly mentioned in the press and various magazines that thyroid hormone can play an important role in that. And so I think the thought is, well, if I take something to quote support the function of my thyroid, that it might make me feel better and make some of my symptoms potentially go away. And I think those are common complaints we get from patients. And whether you're a primary care provider, or, a GYN, which many times acts as a primary care provider for people, or even specialists. And of course, endocrinologists, we have a lot of our patients come in with fatigue and weight concerns.
Yeah, so a lot of experts like yourself actually believe that these supplements might not be a safe option for addressing thyroid issues. Can you talk a little bit about your research in this area?
Sure. And it's interesting. So this kind of started from a clinical experience. I had a couple of patients who came to my clinic at Walter Reed and they had complaints of not feeling well. And they actually had some fatigue and started taking a supplement. Although initially, when we were talking, that didn't come up. Then we talked a little bit more. If I said, okay, what meds are you taking? Then I specifically asked, well, are you taking anything else over the counter? And they said, oh, I'm using this thing to support my thyroid function. And I was like, oh, really? Let me, tell me about this. And I think whether they had the bottle then, they brought it later, and I looked at it and I said, okay. I was able to arrange to get, in two instances, this pills tested, and I found out that they actually had active thyroid hormone in it, which is really a prescription substance. So I think that got me interested and said, well, how common is this? And so we got permission to do a study where we identified the top 10 thyroid support products on the internet. And we did an internet search, found them, went ahead and purchased them. And then we were able to work with our laboratory colleagues and do an assessment of their content and looked to see if they contained any thyroid hormone. And lo and behold, out of the 10 supplements, 5 out of the 10 contain T4, which is one form of thyroid hormone. I think it was Nias, 9 out of 10 had T3, which is the more active of the thyroid hormones. And not only did they contain it, it was in fairly significant dosing. So they would say you would take anywhere from 1 to maybe 3 or 4 pills. We found out there was so much in one pill that we multiply it by how many pills they said to take. And you could be taking anywhere from, as low as 1 microgram, which is not a big dose, up to 91 micrograms of T4, which that is higher than a lot of prescription doses that patients use for thyroid hormone replacement. And then with the T3, it ranged in between 1.3 to 32 micrograms, which is more than the body probably makes an average person. And so a lot of the content was clinically significant, like even 8 to 10 micrograms. You and I know when you adjust patients' thyroid hormone levels, sometimes you're changing from a pill from a dosing of 88 to 100, and that would be within that realm of what we were seeing. So it could impact their thyroid hormone levels. And in those two instances, I had the patient stop the product they were taking, and their thyroid hormone abnormalities went away.
And there was no long-term side effects.
No, locally, they didn't have any side effects from having taken the medication. Although there are concerns if you get too big of a thyroid hormone dose, it could lead to things. But in these two cases, and then we've done subsequent research project and looked at it and then found other hormones for like weight, I mean, not hormones, but supplements for weight loss that had thyroid hormone in it. So this is a pretty prevalent issue from what we can tell.
So how come these supplements are allowed to have it? Are they FDA regulated?
Well, that's a great question and brings up a little bit of you have to talk about how things are decided. And in 1994, Congress passed the Dietary Supplement Health and Education that basically told the Food and Drug Administration that they could not proactively monitor herbs and supplements. It's editorial comment on this. So the Food and Drug Administration, I mean, they check out our food, they check out prescription medications and such, but they're actually precluded of this law to really proactively look at herbs and supplements, even just to make sure they're safe and have what they're supposed to have in it, and not necessarily tell patients you should or shouldn't take it, but just to make sure there's a safety. And that's not done at all. It's all reactive. So patients have to call in or a physician, notify the FDA that there's a problem. They ran into a patient who had a side effect or some type of issue developed, and then find a way to maybe test and show that there's a hormone that's not supposed to be in the supplement or a substance that's not supposed to be in the supplement, and then they can finally do something about it. So that's really not any easy way to prove uh, to the FDA and get this so that they can do something about it and actually go to the company and say, "Don't make it a
So this
change."
lack of regulation, does it pose significant risk to the consumers? I guess we talked a little bit about some of the side effects that you could get. Can you go a little bit deeper into that? Like, what would be the side effects of taking too much thyroid hormone or some of the other hormones?
So I think there's a couple of things. One is, you have patients already on thyroid hormone. So then you're taking a substance that has thyroid hormone in it, and maybe your provider doesn't even know that it has thyroid hormone in it. And then they think your numbers are looking kind of funny and such. And then they get concerned about that. They adjust your thyroid hormone, and then your levels are maybe off. And maybe you're taking the supplement sometimes and not other times. And then the doctor doesn't know this. So that's one thing is you could have poorly controlled hypothyroidism and even have periods where you're hyperthyroid. Now, other things that can happen with that, well, you can get palpitations and maybe even angina, particularly if you already have heart issues, where maybe you have a tendency towards having angina, anxiety, tremor, insomnia, fatigue. And, I like to say thyroid hormone is a little bit like oil in your car. You don't want too little, but you don't want too much. More is not necessarily better. More oil in our car does not make our engine run better. And excess thyroid hormone does not make us feel stronger or do better. It actually wears out the body because the body likes a balance. There's a sweet spot for thyroid hormone, and we like to keep people at. And again, if you're getting palpitations, if it's a TSH is low enough, people can get atrial fibrillation, which is a dysfunction of the upper part of the heart, and it is beating too fast and out of sync with the bottom part of the heart. It can lead to clots and thromboses and strokes and all sorts of things. So it can be serious if they get enough of a dose of the thyroid.
So I know you mentioned the thyroid hormone in there. Is there any other ingredients, specific ingredients in thyroid supplements that can interfere with thyroid function tests?
Sure. So, both in some of the supplements that we tested, and also there are other supplements that are sold for like, oh, you don't get enough iodine. Here are these iodine pills and stuff, have tremendous amounts of iodine. Iodine is the same kind of thing like thyroid in general. There's a sweet spot for it. Too little, not good. And iodine's so important because it's part of the thyroid hormone. So when we say T4, that has four iodines as part of that molecule, and T3, three iodines. So we know iodine is important for thyroid health and thyroid function. But if you give too much, we know there's a famous thing called Jod Basedow. It's named after some German physicians where you can induce an overactive thyroid when you get exposed to too much iodine in your diet or through supplements and such. So, and one of these, and I won't mention the exact substance, but I've looked at it and it has 12,000 micrograms of iodine. Okay, that we recommend
Wow.
individuals get 150 micrograms for their diet, and maybe if you're breastfeeding or pregnant, 250, but not 12,000. So that can cause problems. There's also some supplements people take for hair care, or nails with biotin. It's in the RDA, 30 to 100. It's a little bit disputed if you even need a supplement, but those supplements contain 5 to 10,000 micrograms sometimes. And that's enough not to interfere in the body, but to interfere with the measurement of TSH, free T4, and some other hormones in the body. And so the patient needs to not be on that for a couple days. So it's a water soluble vitamin, and then it won't have the impact on the blood testing and stuff like that. The other thing these supplements tend to have is tyrosine. It's an amino acid. I don't have data that tyrosine in and of itself is particularly harmful in moderate doses. But what I would say is you can't really give tyrosine, give iodine, and expect the thyroid's going to make more thyroid hormone if you already have enough thyroid. It's not gonna do anything because your body knows what you need. It's not gonna take extra and turn it into extra most of the time. Now, again, I did say with the high iodine, sometimes they can jazz it up, but by and large, we have enough tyrosine in our diet. Maybe in the US, you could use a little iodine. Well, you can get that in a multivite very safely. And actually, we would encourage pregnant women to actually take a multivite, prenatal multivite that has iodine in it because there is a little bit of a concern that iodine intake in the US has dropped because usually some people in the US, when they don't live on the coast and eat seafood, aren't getting as much iodine because they're not using as much salt. And for years ago, it was decided to add iodine to salt, and that's how we took care of iodine deficiency. But now people are more careful about their salt intake because we know it can impact blood pressure and heart disease and such.
Wow, so that was a lot of information. So these supplements can contain thyroid hormone, they can contain iodine, they can contain other endocrine hormones such as cortisol, they can contain tyrosine
Correct.
and biotin. Um,
And
it,
there's things that are not necessarily, I'm sorry to agree, there's not necessarily actually even declared on the label. This is part of the problem because they're not being monitored at all. You don't know what else is potentially in these substances. You're taking the good faith that whoever's making them, the only thing that's in there is what they say is in.
yeah, so that actually leads me to my next question. How do marketing tactics contribute to this false sense of safety?
Well, the impression I get, so when we selected our top 10 products that we tested, we looked at, what was on online, and, it's usually, oh, well, this will make your thyroid work better. And it will allude to that, oh, if you have thyroid problems, might feel tired, you might have weight gain, you might have dry skin, you might be constipated. And again, maybe you don't think as clearly, stuff like that. And so they will mention these symptoms, mentions the thyroid's related, and whether or not they come in and say it's going to make it better, because they're not supposed to say that herbs and supplements can treat any condition, but they basically imply that by taking this, you're going to make your thyroid work better and these conditions are going to be better. When in truth, sometimes people feel fatigued because they have undiscovered sleep apnea and it's not being treated, or they have insomnia that hasn't been dealt with, or chronic pain, or a whole host of other things that can cause the same symptoms. And it's not even the thyroid, which is the problem, because thyroid levels maybe haven't been checked by the primary care, or, you know, patients read and they see they have some of these symptoms, they see it's on the thyroid list, and even though they've been told that their levels look okay, they read that the levels aren't accurate, which is a kind of a misinformation that's on the internet, and then they say, well, it must be my thyroid, I have these symptoms, and they want to feel better, so they try taking these substances.
Do people feel better on these substances? I had to ask.
Well, I think by and large not, because one, I think they don't typically. First of all, patient has to have the issue. Second of all, it's not a known way to treat the issue. We have proven therapies around that are prescription thyroid hormone that are regulated, make sure that they have the appropriate contents in them and that they deliver an appropriate amount of medication based on what they're said to contain and such. And so I personally would not have myself or a family member take any of these. If I had actual thyroid, I would want to be managed by a physician or nurse practitioner, somebody who knows what they're doing with this, and making sure that I'm putting on appropriate thyroid preparations that have a, a good oversight, and that I know that I'm getting things that are safe, and then take it appropriately and make sure my diagnosis is correct, because there are a lot of people that are misdiagnosed with thyroid disorders, and they feel better maybe transiently on a prescription, or maybe even transiently better in the supplement, but not long term, because maybe that's actually not what the problem is.
And just to clarify, this should never be used as a treatment for hypothyroidism. I know you said if they don't have any thyroid problems, this could make them hyperthyroid, but isn't really going to do much. But for those patients that are hypothyroid, if it contains thyroid hormone, we should still never use it.
Correct. I would never recommend someone take these supplements. Again, if you want some selenium or some iodine, you can get that in a multivite. And I think, judicious use of multivites is fine. Um, but I would never take one of these supplements that purportedly is to support thyroid function, because don't think it's necessary. Most people with a well rounded diet aren't going to need them. And then again, if you have hypothyroidism or a thyroid condition, you need an actual treatment for that, and not this, because these things are not going to work in any reliable fashion whatsoever. So I would not recommend anyone taking them. I mean, I'd actually recommend actively avoiding them, because basically they have an unregulated amount of hormone content. And as we were discussing in my study, there was a wide variety of what was in there. As you know, again, you could have as small as a microgram or two up to 90 micrograms of T4. I mean, so depending on the substance. And one thing we didn't study is we didn't buy the same product over a year or two and keep retesting it, because we weren't able to do that. But I can't even tell you how reliable the content is over time.
Yeah, so speaking of that, should there be stricter regulations or better transparency for this for thyroid supplements in the industry to protect consumers?
Well, going back on the FDA, so again, we have them regulate our food, drugs, and even cosmetics. Cosmetics that we put on our skin but don't ingest. Why? Because we know they can be absorbed and there can be problems. So to me, I think we'd want the FDA to be able to oversee and make sure that supplements have what they say is supposed to be in them, not things that aren't supposed to be in, and also make sure that there are no claims being made that a substance is going to do something which it really hasn't proven to be done. Because again, there are no good studies with these supplements showing any efficacy. So to me, that's part of what the role of the FDA is. And I would just say that the supplement and herbal industry is, I think, a billion something industry in the profits that they make. They are known to support their Congress people and stuff. And so I think they weigh on influencing that. But I don't know that they always have the best intent on the customer because they're more concerned about selling their product than actually putting out something that they know is proven. And that's maybe some very direct comments, but that's what it pretty much seems like.
Yeah, so hopefully in the future we get some better regulation. But in the meantime, actually, what do you tell your patients? What are some safer alternatives that exist for managing thyroid health?
Terrific. And one thing I think I do first is we delineate what are their symptoms. And then we talk about, okay, so you feel like you had brain fog. And then we talk a little bit about their sleep and do they have restorative sleep in that. And if they don't have that, we talk about, okay, so one thing we're going to deal with is your sleep because whether you have a thyroid condition or not, if you're not sleeping well, you're going to feel tired. Okay. Whether it's insomnia or it's sleep apnea, it needs to be dealt with. Or if you have chronic pain, it's an energy sucker, that's got to be dealt with. So that's an important thing. And a lot of times, as an endocrinologist, I need to work with their primary care provider on that because the care of some of that is going to fall outside the scope of practice for an endocrinologist or a thyroidologist. Then, if we've identified that they definitely have thyroid problems, well, then we talk about what are the therapies that are available that are basically have data behind them, that research has been done, that we have clinical experience, and that there's oversight on those products. And then we talk about what the options are. A lot of people end up on a T4 based therapy if they don't have enough thyroid hormone, something like levothyroxine, which is the generic or it comes in many different types of brand names. Some patients, in combination with T4, get a little T3 or liothyronine. You have to use that carefully. That's going to be in lower doses. And then there's another group that some are still on the older product of desiccated animal thyroid hormone. So it's basically taking animal thyroids, chemically digesting them, and getting T4 and T3 out of that and turning into a pill. And there are various different brands for that. One of the concerns with those particular substances is that there's a ratio that is found physiologically in the human of T4 to T3. There's usually 10 to 14 T4 molecules to one T3 molecule, and T3 is more active. So then in these animal drives, it tends to be T4, 4 molecules to one T3. So it's a much higher ratio, and our bodies don't necessarily need all that extra T3. So it's not necessarily very physiologic. I will also say that the pure T4 is not purely physiologic either because it's primarily more T4, but most people can convert T4 over to T3 appropriately. Yes, there are some people that maybe have a little bit of a reduction, but another thing that's out there that's a little bit of a wise tale is there's nobody out there who can't convert T4 to T3 at all. And I have patients tell me that because they've been told something about having problems with conversion. Thing is, you can't make it and be born without T3 because it's essential to developing in your mother's belly and such. So people can make T3, some people make a little less, and that gets into if you have hypothyroidism, maybe you do better on that combo T4, T3. Uh, but again, going back to the desiccated animal thyroid hormone, some people like to be on it. A lot of thyroid specialists aren't very fond of it because you get weird thyroid function tests. It doesn't seem very physiologic. And so many patients can do great on T4 based therapy, but that's not necessarily every patient either. So.
Well, thank you for sharing that. And for the listeners, we also have a separate episode on T3 use with Dr. Bianco that you can listen to as well. Um, Dr. Burnett, can you summarize for us just really quickly the main reasons why thyroid supplements are not considered safe for most people as we end this episode?
Sure. So, thyroid supplements, the issue is it's an unregulated product that has variable amounts of content, including active T4 and or T3, both of which are prescription substances that need to be monitored and prescribed by a physician or provider, a nurse practitioner who's overseeing your care and following your thyroid hormone levels. It also could have exceedingly high levels of iodine, which may cause problems and or other substances. So because these substances and products have not been shown to be efficacious for the treatment of a particular disorder, and as we know, we have very good treatments for hypothyroidism that we would like to use what we have data on and that we can use safely and do it under again the supervision of a medical provider who has understanding about thyroid and will help you avoid too much thyroid hormone and make sure your levels are optimized, because I think both you and I can agree that thyroid is important. Thyroid needs to be optimized. The American Thyroid Association, part of our motto is optimal thyroid health for all. And so I think that we very much are interested in that. But what we're worried about is patients are probably getting exposed to contents they are not going to benefit or might even harm.
Thank you. And as you alluded to earlier, it's so important to take that extra 5 minutes to kind of talk to your patient about their health overall and really acknowledge their symptoms and investigate where their symptoms are coming from. Because I feel a lot of patients often feel brushed off and they might resort to these supplements as a second line of treatment, especially if they're not getting that clear message that their symptoms are being investigated and acknowledged by their physician or nurse practitioner as well.
I thoroughly agree.
But thank you so much again for joining us today, and please stay tuned for our next episode.
Great. Thank you for having